Hi, my name is Mary, and today's topic is medical errors and the importance of responsible reporting. Medical errors are paramount in healthcare and usually occur in a hospital setting. According to research, about 400,000 hospitalized patients experience one form or another of preventative harm annually. So, what exactly is a medical error? Well, there are two definitions dependent on the situation. A medical error referring to the failure of a planned action to be completed as intended is considered an error of execution. For example, a common medical error regarding the failure of execution is a botched surgical procedure. There are so many cases where surgical patients find out that sponges or other miscellaneous objects were somehow forgotten in their body. That is an example of error of execution. An error of planning refers to the use of a wrong plan to achieve an aim. For example, a nurse administers medication that is not intended for the use that she is planning to use it for. In other words, a nurse administers pain medication that is meant to help with pain as a way to sedate the patient. That is using the wrong plan with the aim intended. Overall, medical errors are usually preventative mistakes made by healthcare professionals. Medical errors affect many people. Some of the stakeholders include the patients and their loved ones. Medical errors kill so many patients every year, and their loved ones are affected by the death. In addition to patients and their loved ones, healthcare professionals are also negatively affected. Physicians and nurses can get into a lot of trouble for medical errors. Hospital administrators can be affected by medical errors through their association to the physician and nurses they manage. Health systems and hospitals are hugely affected by medical errors. Their reputation can be tarnished, and they are almost always financially liable for medical errors. Medical errors cost hospitals about $20 billion a year. That includes treatment costs, lawsuit settlements, legal fees, etc. Medical errors are significant in today's world because they affect so many people. In addition, medical errors are not responsibly reported, especially to the public. In 2013, medical errors accounted for an estimated 251,454 deaths. This number more than doubled considering there were about 98,000 deaths due to medical errors back in 1999. Medical errors not only affect the patients, but the healthcare system is heavily burdened by the medical errors and their costs. As stated earlier, hospitals lose billions of dollars annually to medical error costs. In addition to the financial burden, the hospital staff are burdened with the fear of termination if they report a medical error. Many medical professionals fail to report medical errors to avoid being ostracized and/or terminated. My thesis statement is as follows. Medical errors are inevitable and should be reported to reevaluate and revise medical processes to minimize harm to patients and create the most just outcomes for the patients, the healthcare professionals, and the healthcare system. There is a lot of ethical controversy behind medical errors and the reporting. All of the following ethical principles can fit the medical error controversy regarding responsible reporting. Autonomy can best be described as the right a patient has to their body. That includes the right to know of a medical error that directly affects them as the patient. Non-maleficence refers to the do no harm rule of healthcare ethics. Healthcare professionals should not harm the patients, yet most medical errors can be connected to negligence in one form or another. Beneficence refers to the ethical duty of a healthcare professional to act in the benefit of the patient. By responsibly reporting a medical error, that patient may be able to receive proper care to help fix any damage rendered as a result of a medical error. A medical error is usually inevitable, especially when considering the situations regarding surgical procedures and treatment. However, the ethical principle of justice morally obligates the healthcare professional to be honest. The doctor or nurse should seek justice for the patient and report the medical error regardless of their role in it. Lastly, utility plays a vital role in medical error reporting. Healthcare professionals, as well as health systems and hospitals, should report medical errors because that can change the outcome of the patient. For example, responsible reporting can get the patient the help necessary to minimize the harm the medical error has caused. By being honest, the healthcare professional may be pardoned and required to seek further education and training to prevent the chance of another medical error from happening. Responsible reporting of medical errors is overall the ethical thing to do. Laws regarding medical errors and their reporting vary heavily on the state. However, the National Medical Error Disclosure and Compensation Act of 2005 covers the United States as a whole. With this act, it allowed a federal Office of Patient Safety and Healthcare Quality to be established. The act also required insurance companies and healthcare providers to aid in costs acquired from medical errors. In addition, it provided a sense of safety for physicians to report medical errors without fear of medical malpractice suit or being viewed as a scapegoat. In other words, most times when a medical error lawsuit came to be, the physician would directly be affected financially. This law helps minimize the financial burden on physicians and promotes an open policy for physicians to report medical errors within their health system. As of 2010, 34 states have apology laws. 25 of those states have specific medical laws. 9 states have disclosure laws. 6 states have both apology laws as well as disclosure laws. 16 states have no laws whatsoever regarding medical errors. Illinois has no laws in regards to the reporting of medical errors. This is sad. Here is a political cartoon dating back to 1999. The cartoon portrays a group of doctors and/or nurses reviewing a patient's medical report. It reads, "This report says medical errors such as indecipherable prescriptions cause the deaths of 98 patients a year." Or is that 98,000? It's hard to read this. In any case, we're supposed to report them. Or is that repeat them? This is a cartoon, but that question is our current reality. Resolution of the controversy or outcome of the case. So I decided to look into Josie King's case. In short, it's about an 18-month-old child who fell into a bath with scalding hot water and suffered severe burns all over her body. She was rushed to Johns Hopkins Hospital, where she made a successful recovery after spending several weeks in the PICU. 2 days before Josie was to be discharged, a nurse administered the wrong narcotic that resulted in Josie's death a couple days later. Johns Hopkins acknowledges the medical error right away, and they offered the King family $1 million to settle privately and to keep the matter disclosed between the family and the hospital. Sorrel King, Josie's mother, made a public scene forcing the hospital to publicly report the medical error in order to settle the matter out of court. So the hospital ended up publicly announcing their medical error in order to settle with Sorrel King. Medical errors are inevitable, but reevaluating and revising current processes and procedures regarding medical practices may help minimize future errors. If the same medical error is being made, it is not a bad person, it is a bad process. Using tools to help minimize risk of medical error can also be helpful, like STAR, which stands for Stop, Think, Act, and Review. It allows healthcare workers to refocus and evaluate their actions before following through. Overall, we want to responsibly report medical errors. Healthcare professionals should follow the ethical laws of medicine. Number one rule, do not harm. But once a medical error has happened, act in the benefit or best interest of that patient. Be honest and seek justice for a patient who has been a victim of medical error. The outcomes can vary on how the medical error reporting is conducted. These are my references. Thank you.